The advantages of working on an unused site as opposed to an occupied site are that there are far fewer constraints to the design development programme and then subsequently to the construction phasing. There are less things to have to work around, it's a much more open environment, and the location of the building on the site and the design development from that point of view are much more freer to develop in a way that suits the clinical healthcare model. On an occupied site, the design, development and construction phasing has to work around the live operation of that site, the constraints of car parking and access and people generally moving about their business on the hospital. The Glenmavis site location can provide the 40 acres necessary for the new University Hospital Monklands. The site is large enough to build a hospital that can deliver the clinical plan designed by NHS Lanarkshire's doctors, nurses and their healthcare professionals. It requires a large ground floor area of 34,000 square metres so that key departments can be closely located together. Glenmavis has enough space on the site to accommodate an expansion of the hospital. 2 entrance or exit points would be available at the Glenmavis site. Unlike the current site, which only has the one, a new road is planned, the East Airdrie Link Road. It runs from the M8 north of Newhouse Interchange to the north of the village of Stand, which is near Glenmavis. North Lanarkshire Council is planning the road as a single carriageway with a design that allows expansion to dual carriageway if funding becomes available. The Council has confirmed that this funding is not in place. Local road and junction capacities would, however, require improvement to manage the increase in traffic. Funding for this has been included in NHS Lanarkshire's financial analysis. The link road is set to be built between 2023 and 2025, meaning construction traffic for both the new road and the hospital would have to use the A73 at the same time. The site at Glenmavis is 2.4 miles from Drumgelloch train station and 3.4 miles from Greenfalds train station, meaning a connecting bus service from rail services would require to be put in place. There's a high pressure gas main crossing the site, which has a 50-metre exclusion zone around it. This would have to be taken into account when designing the site layout, as buildings couldn't be built on top of it. No remedial work or detailed site investigations have yet been undertaken at Glenmavis. There are historic mine workings in the site, but funding for this has been taken account of in NHS Lanarkshire's funding analysis.